If you have this in your hip area, like trochanteric bursitis is a really common one, hip flexor bursitis. If you just have pain in the front of your hip and you're in your younger years, eventually all that stuff leads to hip osteoarthritis once you're in your 50s, 60s. Some people get in their 40s as well. But by the time you're in your 70s and 80s, that's what's going on. And then you end up having a hip replacement. And so that's what I would like to help you prevent today in this talk, in this video, is let's figure out how to kickstart your hip arthritis recovery so that you can begin to fix hip arthritis for the long term. Before we get going here, we're going to comments right now. Can you guys let me know where you're from? Drop in the comments what part of the world you're in so that we can see where everybody's here. We have Kenneth Dignes, G8F. He just became a YouTube member. Fantastic. We're live on YouTube, guys, on Facebook and on Instagram. I can see comments from Facebook and YouTube, but not from Instagram. So in case you're dropping us comments on Instagram, we'll run over to Facebook and YouTube so we can see you guys. We also have to Tab 5515, also became a YouTube member. Fantastic. And they say, hello, Dr. David from Dixon, California. Awesome. So cool. Thanks for joining us here. Thanks for becoming a member. For those of you guys that are wondering, on YouTube, you can be a member of the channel, like a paid member. It's a feature on YouTube. Oh, Bev4848 says hello. Hey, Bev, from Annapolis, Maryland. Fantastic. That means that we just get back to your comment quicker than everybody else. We prioritize answering YouTube members' comments. It's not the same as being in one of our programs, like our recovery programs. It's a whole different ballgame. Who else is with us? I see Marion Kirchner from Albuquerque. Oh, that's just up the road from us. Fantastic. We have Cam from Coventry, UK. Welcome. UK's here. Another US person. We have Joe Cool USA. I'm following this from Pennsylvania. Thanks for joining us. I hope you're staying warm up there. Liz is in Los Angeles. Fantastic. Liz Lyons, PhD. Glad you're with us, Dr. Liz. We have Cindy King. First time watching live from Odessa, Texas. That's even closer than Albuquerque. My goodness, y'all are getting close to here. And then Cindy King says, question, is hip arthritis the same as hip osteoarthritis? Thank you. Excellent question. And the answer is yes. I use the word arthritis as shorthand for osteoarthritis. There are different types of arthritis. There's psoriatic arthritis, juvenile arthritis, rheumatoid arthritis, and there's other kinds too. Those are probably the big ones. Osteoarthritis is what I'm talking about today. So if you're joining this live expecting help for like rheumatoid arthritis, psoriatic, one of those other types of arthritis, something that isn't osteoarthritis, I am not the best guy to help you out. Some of this information might benefit you, but you're going to have other factors affecting your hip arthritis, your certain kind of hip arthritis, and you need to make sure to talk to the right kind of doctor for that. I'm not that kind. I help people with hip osteoarthritis, and that's what this whole talk's going to be about. The good news, though, is hip osteoarthritis is by far the most common type of arthritis for hips. So this should help a lot of people. Great question, Cindy. Thank you for that. Harriet Sanders is in New Jersey. Welcome, Harriet. Thanks for joining us. Milvid says hi from Liverpool. Very cool. Another UK person. Kate 60 says good afternoon from Richmond, Virginia. Welcome, Kate. Glad you're joining us from Virginia. Bev says, I have hip arthritis. Question, is it beneficial if I sit on my exercise ball and swivel my hips in a circle rotation? I know what you're talking about. So those big yoga balls is what they have different names. Exercise ball, yoga balls. The big ones that you can sit on like a chair. And if you move your hips around, that is mildly beneficial, I'd say. It's maybe potentially going to help you out with just loosening your hip joints, but it's not really fixing hip arthritis. But it's a good way to begin to activate muscles. You have to kind of be conscious of which muscles you're activating. We'll talk about that today. It's a good starting point. I'll put it to you that way, Bev, but there's a lot more work to be done, a lot more thought to put into your exercises. But I'm going to help you out with that today, Bev. So hopefully I steer you in the right direction. Guys, let's talk about our topic today. Let me something fell here. Trying to be as interactive as possible. And so we have some little pictures that we'll use throughout our talk here. But let's get going on this. So let's cover the 10 no BS tips to fix hip arthritis in 90 days. The number one tip that I have for you guys, this is an enormously important one, and it is to offload. Let's not use that marker. It's a little dry. Offload. What I mean by offload is using a device like this. This is a cane. We also have a walker and some crutches. Let me grab it real quick. Let's not knock down any lights here because that wouldn't be fun. So when you walk, if you put some of your weight through a cane so that you take pressure off and offload the painful side, or you can use crutches too. You can use one crutch, ideally use two because you're going to offload the most. Or even better, if you need a lot of support off your hip, you need to use a walker like this. And now think of it this way, because before you're looking at the walker and saying, oh my gosh, I'm not that old yet, I'm not that bad yet. Here's the thing. If you stand up right now, if you have hip arthritis and you stand up, your hip hurts. As soon as you bear weight on that hip, you think to yourself, ooh, that hurts. Your hip joint is so irritated and it's so sensitive right now. The arthritis is that sensitive that just standing with your normal body weight is causing worse irritation. It's potentially injuring you. And the hip joint, the ball and socket of the hip joint is designed to take weight. And if it can't do that pain-free, safely, and confidently for you, if you don't have confidence that you can go walk to do all your things that you do every day, then you need to take pressure off that hip joint so that you can give it a chance at some time to rest and recover. And then once it does, you can get back to walking without the cane, walker, or crutch. But in the short term, you need to go to the store, go to, you can get these at like a pharmaceutical store or any department store or grocery store that has a pharmacy section, first aid section. They'll have one of these things. They'll cost you anywhere from 20 USD to 50 USD. You can get some really fancy ones for hundreds of dollars, but something basic gets the job done. It just depends on what you want. Crutches will run you $30 to $40 for some basic crutches. And a cane like this is $20 to $30, maybe $40. You can always spend more on these, but you just need something that holds up your weight. And just understand that this takes off 10, if you're lucky, 20% of your body weight. If you need to take more off, if you stand up and you feel that hip pain and you use the cane and you're thinking, I need more support, don't hesitate to get out the crutches or the walker because you will benefit tremendously from it. You're going to avoid a hip replacement if you can get the pain under control. The reason why I have these set up in different ways is because I said 90 days, I'm thinking in terms of 30, 30, 30. So the first 30 days right here, you need to be offloading and successfully offload so that you can get the hip joint to calm down, because there's other things coming that you need to do in my plan here to heal hip arthritis, but it requires you not being in pain all the time. You need to be able to stand up in the middle of the night to go to the bathroom, or wake up in the middle of the day and then go to the kitchen and take care of your meals and your family, whatever you're doing, and not hobble along, because by the end of the day, you're going to be a wreck. And then you wake up stiffer in the next morning, and then this is just a terrible cycle that people live in, and then they get worse and worse and worse. And it could be solved by a $30, $40, $50 device. But what you often have to get over is that stigma, that feeling of like, as soon as I walk out of the house with this and I show up at church or I go to the store, I bump into a friend or my family sees me, they're going to think the worst. And I have to explain myself. And yeah, you need to go through that. You need to face it, because what you're probably thinking is people don't get off of these. That happens a lot. But that's because they don't have the rest of this plan I'm going to explain to you. What people that go through my treatment approach end up doing is they'll use this for a time, a couple of weeks, maybe a week. Maybe you're not that bad. Maybe a month. I'm giving you a month here, but then you can wean off of it into the next part of the program. And you don't need this around anymore. Keep it in the closet, keep it in the garage, put it in the basement of the attic, just in case. But you don't need to be surviving on this like many people do. and they're using this until their last days, maybe even progressing to a wheelchair. So guys, offloading, I hope I stress the importance of it. I can't stress how underdone it is. And healthcare providers, by the way, they don't recommend this to you guys until you've had a surgery. They wait until you've had surgery. I've seen so many people see their doctor, get the shots, take the medications, go through physical therapy, and they're hobbling and in pain, and they never get told, why don't you get a walker? They said, no, stretch it out more, exercise it more, keep doing other stuff. Meanwhile, they're in worse pain, and nobody recommends get offloaded. It bugs me so much because the only time I see people on a walker is after they get the hip replacement done, because you have to at that point. You just had parts cut out of you and new parts installed, and it's 1000% necessary at that point, but then you're going to be on it for months and months, potentially never get off of it. I would rather you spend 2-3 weeks using this while you still have your original hip joint so that you can let it heal and then let go of this for the long term and never have a hip replacement. That is my desire for you, but it's your life, it's your hip. All right, let's go on to number 2 here, guys. I'm going to show you an exercise, kind of an exercise. I'll show you what I mean. It is called thigh fidgeting. All right, thigh fidget here. And let's show you what this looks like. Really simple and straightforward. Let me get the hip joint model as well. So this is a hip joint, and in there is the ball, and in there's the socket. And if you imagine sitting, this joint doesn't move very good on this model, but my hip joint, oh, I have the skeleton. Even better. I'm sitting, and so I put this hip in a sitting position, just like this. What I want to do with my leg is just wiggle the legs. And you can do both because it's easier. Now, people do this with their legs all the time, and what's happening at the ball and socket joint is you're just putting a little wiggle in the joint, and that's really good to get the fluid inside the joint circulating, because that's where the cartilage is. On the ball of the hip joint and inside lining of the socket, it is layered with cartilage so that the least amount of friction possible is happening in there. It's not just a cushion, it's also to decrease friction so that there can be movement there with minimal stiffness, with minimal friction. And the health of the cartilage depends on the circulation of the fluid inside the joint. But if you're in pain, that fluid doesn't get much circulation because you're probably off of it. But if you just wiggle your thighs like this, you just get it circulate around. And that's good because the cartilage cells on the end of the bones there allow then metabolism to occur, which means the healing can happen. The cells can go through their process to get rid of waste products that they generated as a result of going through healing. And then the fluid, the joint fluid, can take up that waste product and put it back into your bloodstream so your body can process it and exchange it for good, healthy nutrients that need to come in. Fresh water needs to come in to be put back into your hip joint, but you need to be wiggling that hip joint in a way that doesn't hurt it and circulates the fluid. So what I recommend when you're in the first 30 days of these 90 days is whenever you're sitting around, and you're probably not going to be walking much, you're going to be offloading as much as you can, hopefully, but do this. You know, we call it the pee-pee dance in my household. We have little kids and they start doing this and we tell them, you got to go to the bathroom, come on, let's get going. But you're doing this intentionally just to move the hip joint. And what I want you to do is 3, 5, even 10 minutes every hour while you're sitting, just to get some movement in. This should not hurt. If it hurts, don't do this, obviously, but for 90% plus of people that have aggravated hips, this is going to actually feel good for them. They're going to feel relief because of that fluid circulation inside the hip. They will get less stiff. You know, when you've been sitting for a long time and then you stand up after you've had a meal or you watch a show or something, you get that, oh, my hip is stiff, and you have to, you know, let it loosen up for a bit for the first 5, 10 steps, maybe 10, 15 minutes. If you're doing this throughout your sitting time, I'm saying every hour, but we have some people that say they just do it more frequently than that. Every 10 minutes they're doing it for a minute at a time. You are constantly moving that joint and you're not going to let it get stiff, and you're allowing healing to happen. So this is a really good beginning of your hip arthritis recovery journey exercise to do. This is not one that you'll rely on to get all the way better, but this is an excellent starting one that needs to happen within the first 30 days of healing your hip arthritis. Super easy to do. You shouldn't get tired. You shouldn't be sweating doing this. It should feel like you're just doing some nervous tick, and it kind of looks casual. You know, nobody will really say anything. They might say, do you need to go to the bathroom? You just got to say, no, it's a hip thing. I'm just trying to heal my hip. And it's no big deal. So thigh fidgeting, I can't state how beneficial this is to you guys. You have to try it out. And like I said, hourly is important, because if you just do this once a day for 5-10 minutes, it is not enough. That fluid is stagnant potentially, or not very mobile the rest of the time inside your hip joint, and you need to recirculate it by getting consistent pain-free movement into your hip joint. So that's what this is here. Hope that makes sense to everybody, guys. All right, let's get into the next one here. And this is not an exercise, more of a thinking one. So I'm going to put a brain here. But you need to forget your x-ray. And think about this here, because if you have hip arthritis, chances are you went to the doctor at some point, got an x-ray, that's how they'll diagnose your hip arthritis, and you saw the image of your hip, and the ball is right here and the socket is right there, and usually they do both sides so you can compare, and the side that hurts probably has decreased space, so they say you have bone-on-bone hip arthritis, and there's other signs in there like thickened bone, like very white-looking bone, versus your other side might probably have good spacing and it looks normal, the bone looks normal. Maybe you have it on both sides too, but the doctor will usually show you the image of the x-ray and connect it to your pain and say, that's why your hip hurts, because look at this x-ray, no space in the joint, cartilage is gone, you're a good candidate for a hip replacement. They might tell you that. But here's the thing, we know by research that it's possible for you to have things torn, things that look worn out, bone spurs, those are called osteophytes in the medical world, but bone spurs is the normal name, and you can be pain-free. You can have torn cartilage, even torn tendons, and it's possible for you to not even know it because you feel great. What that means is that you cannot rely on the x-ray as the number one thing to have surgery, as the deciding factor to have surgery, or for you to not progress in your recovery the rest of your hip health. In other words, I don't want you to be labeled by a bone-on-bone x-ray. This is important, and I put the brain here for you because this is a mindset thing. Many of you guys have that image of your x-ray burned into your minds, and every time your hip hurts, you're reminded of it. You think about it, and I've had patients come and tell me, like, every step that I'm taking, I'm just wearing away the cartilage even more because I saw the picture on the x-ray and it's already worn down. And you have to let that go, because there are people with massive disc herniations walking around in their spine and they don't even feel it. They feel great. There's people with torn rotator cuffs. There's people with meniscus tears in their knee. There's people with osteoarthritis in their knee and they feel fantastic. And we have the same thing happen in our hip arthritis recovery program. We have people that start with a lot of pain. We put them through similar, offloading, thigh fidgeting exercises. There's other stuff in our hip arthritis recovery program. And a month, 2, 3, 4 months or longer, they're walking without pain. Some of them are getting back to hiking and exercising in the gym, lifting weights, doing deadlifts with the long barbell. They're older and they had that x-ray. So they've aged, because this is not an age-related problem, but doctors say that it is. And they had the x-ray that showed bone on bone, but they had to go through this mindset shift of forgetting about what their x-ray says, letting go the bone on bone diagnosis, and that leads to a joint replacement surgery, because it's just ammo. It's ammo for your doctor, for your surgeon to be like, let me put another bullet in the gun. I'm gonna get this patient. You have an x-ray and it's bone on bone in your hip. we have a clear sign here that it's surgery time for you. No. Dodge that bullet, guys. Forget it. Don't let it define you. Make sure that you realize the things that are good for you. Like, you probably have some good days here and there. That's a clear sign that that bone-on-bone hip, as the x-ray shows, is not an everyday thing. Because the fact of the matter is, an x-ray is a picture, and you can have a picture taken of you with not the best light, or not with, with your hair done or your makeup done the best way. You might not look good in some pictures, but you might look fantastic in other pictures. Your hip goes through the same thing. They probably caught you on a bad day. You went to the doctor when it was worse, and that's when they did the x-ray. Then a month later, you might feel fantastic and you're looking great. And if they were doing an x-ray at that point, it might look better. So don't get hung up in the x-ray. You need to change your mindset about that. Believe that it's not an age-related problem and that this can be fixed. Okay, next one here. Oh, we have the helpline open, guys. So the phone number's right here. I forgot to mention at the beginning of this live stream, I am taking calls. So if you want to call and ask me a question, I'd love to help you out. Just dial this number right here. We have somebody standing by answering the phone line, ready to see if it's a good thing to bring you on with me. I would love to help you out. Call us right now, guys. Let's talk to number 4 here, the muscle imbalance. This is kind of the next step after getting the x-ray, because it's a jump. You have to trust here, because you've probably grown up in a world where the x-ray is king and the MRI is king, because some people get the MRI instead of the x-ray, and they think there's nothing that you can do. And I've been doing exercises, I've been doing hip arthritis exercises, but I'm presenting this new idea of a muscle imbalance. It's something that I've got from mentors over the years and kind of put together and kind of made it my own. But this idea of the muscle imbalance is crucial for you to understand and know, have it in your brain so that it makes sense for you the rest of what we're going to do, because it's going to be kind of contrarian to what the rest of the medical field will teach you to do. So let me just explain the muscle imbalance. Come on over here with me. Let's go to the skeleton. In case you've never heard me explain this, or maybe you have and you just want to wrap your mind around it better. Skeleton likes to do funny things, that's double jointed in many areas. There we go. Maybe not. All right, another day. Here's the hip joint. You have muscles on the back. Those are your glute muscles, the butt muscles for the everyday term. And then on the front side here, you have hip flexors. You have abdominals, of course. You have internal organs in your stomach, your guts, all that stuff. And then behind your guts, you have a group of muscles called the hip flexors, and they run from the spine. They attach to the surface of this bone in the front here, and then they come down and attach to this part of the thigh bone right here that kind of sticks out, this pokey part right here, this spine-looking part, thorn part right here on this thigh bone. And when these muscles contract, they bring your knee up, they flex your hip, they create flexion in your hip. And then the glutes in the back, they attach to different parts of the backside of the thigh bone right here, and they move your hip back. So those two muscle groups, they oppose each other. And when I say they oppose each other, it means they do the opposite motions, and that's important around the joint because the joint needs to be able to move in many directions. Just like an elbow, like you have a bicep here that bends your arm, and then you have the tricep on the back of your arm that straightens your arm. And you have to have a balance between those two muscles for the joint forces, the pressures within the joint to be good, to be normalized. When you have this muscle imbalance that sets up hip arthritis, you have too much strength on the front relatively and too little strength on the back. That's where the glutes are. So the classic sign that I see, and this might be you, is way too little glute strength. Very, very often people say, I've lost my butt. I have old man butt. And women that have more shapely features on their hips, they have bigger hips than men typically, they might say, well, I do have a butt because I'm a woman, but the muscles don't work. And what you have to think about is, when is the last time you felt tired, like muscles tired, fatigue in your butt muscles? Probably hasn't been in a long time, because you probably felt more tired in your thighs or the hip flexors, because there's some thigh muscles that go down towards your knee that also act as hip flexors. And by the way, the same problem can cause knee osteoarthritis. So some of you guys have both hip and knee osteoarthritis. It's because of the same muscle imbalance that sets up this bad pressure at the hip joint. Let's go around the other way. Sorry, that looks weird. But when you understand this imbalance, that the glutes are weak and the hip flexors are dominant as a result of that, they compensate. When you're supposed to be using your glute muscles to walk, for instance, or get up out of a chair or to do exercises, if they're not strong enough, if they're not active enough, by default, your body compensates. It figures out a way for you to get up out of that chair or to get across the room or down the street, wherever you are, through the parking lot, and it uses other muscles. And when you use those other muscles, it changes the way that the hip joint behaves. And if that's the way you live, that's the way you move every day for weeks, months, years, that's when you start to grind at the joint and cause hip osteoarthritis. So if you can get this is big, and it's not that complicated, guys. It's just weak glutes, dominant hip flexors and thigh muscles. The medical field at large, the people that are, the surgeons that are recommending surgery, the doctors that are recommending the injections, the physical therapists that you've had worse outcomes with, they don't understand this. And I'm not trying to throw them under the bus. Like, just understand that they're great at certain things. Like physical therapists, they're great at helping people after surgery. But if you're trying to avoid a hip replacement, they're probably not the best ones to see. Look around. If you've been to the clinic and you see people that have had surgery, you talk to the other patients while you're on the machines there, and you ask them, why are you here? They're probably going to say, oh, I had a hip replacement. Oh, so this is one of those clinics that treats people after the hip replacement or the knee replacement or the back surgery. If everybody's had a surgery there, most people, you're seeing a physical therapist who specializes in helping people after surgery, and they're excellent at that, very likely. But if your goal is to avoid having a hip replacement, you probably need to leave the clinic. You probably need to find someone else to help you out. We can do that for you here, or you can find somebody locally as well. Once you fix this imbalance, though, life gets a lot better. The ball moves into the right position in the socket, the force is normalized, and you're going to be able to do a lot more things. That's when life gets better, and you're a big step away from having a joint replacement surgery. All right, guys, so just to round out the first 30 days, come on with me over here, because that's what I want for you to hear. Let me write that up here, in fact. This is going to be the first 30 days. Is going to be your 60 days and 90 days over here. Offload first. That goes for as much as you need to. Eventually, you'll wean off the walker or the crutches or whatever it is. Throughout the day, all day long, you should be thigh fidgeting. There's other exercises to do. We'll talk about them next. The mindset, though, I wanted to include these on here. You have to stop thinking about the x-ray. You have to start thinking about the muscle imbalance, because that's going to set the tone for the rest of your recovery. If you're focused on the x-ray, you're probably going to go get it fixed by the surgeon. That's what they do. They're going to focus on the x-ray for you, and they're going to tell you, yep, let's replace it. So I would say just put it on hold for a minute. If you're going to give this a good go, you can always come back to the surgeon if it didn't work out for you. Then the muscle imbalance. You need to understand that, because you're going to find exercises on the internet. You're going to find healthcare professionals you see in person that are going to say, let's work out your hip flexors, which is the wrong muscle group. It's going to feed into the imbalance. It's going to make you worse. This is why people get worse doing certain exercises. And I'm a huge proponent of it shouldn't hurt worse to fix your hip arthritis problem. You shouldn't feel pain in exercise in order to get the outcome of recovery. It should be feeling better and better and better and better. And sure, maybe you have a day where you overdo it because you're feeling better and you go walk extra, you go through an extra store, you do something that's just a little bit more than what you're used to, but it shouldn't come from an exercise that you did, as long as you're using the muscles correctly. All right, guys, that's the first 30 days. I'm going to answer some comments next. Let's see who's with us here. We have Lainey's Majovitz, 3754. She says, question, I know that I have to work on my glutes. Awesome. But some of the exercises hurt my hips. What do I do? Great question, Lainey. It might be an exercise that's too advanced for you right now. Because there's, like squat exercises out there. There's bridge exercises. I'm going to show you some of these exercises here in a minute as I go through my list. But you have to do the glute exercise that makes your glutes work, activate, and get fatigued without causing pain. That's probably what's happening here. And if you found that right exercise, but then you start doing it and it starts to hurt, it might be that you can only tolerate so much. You might only be able to tolerate 30, 50 reps. And if I said do 100, you're not there yet. You need to start at the 30 to 50 that feels okay, doesn't hurt you, but you feel it in the glutes. And then as you get stronger, you'll be able to tolerate 70 reps, 80 reps, 100 reps, or whatever it is. You might be at 1 or 2 reps. And you might need to be just doing that. And as you get better, you can work your way to 10 reps. Just make sure that you're listening to your body, because every time you push it and your hips start to hurt in the joint, like usually in the crease of your where your thigh meets your body, that's where hip arthritis classically hurts. That means that you're irritating it. It's like picking at a scab. If you had a cut on your skin right here, you would let it heal. You wouldn't do anything to irritate it, but if you pick at that scab, you're going to cause it to bleed, which means you're going to have to go through the healing process all over again. If you overdo it and hurt your hip joint while you're trying to recover from it, you're probably going to have an experience where you say, I'm paying for it the next day. That means you went too much. And it could have been that you're doing the wrong exercise. You're not there yet. You need to do some easier exercises, or you're doing the right exercise, but you did too much of it. You need to reduce the amount of reps. You need to reduce the intensity of that exercise somehow, some way. I hope that helps, Lainey. Great question. Nancy Morales, 6817 says, I have been in this program for almost 2 years for my hip. I have all the mobility. Fantastic. I feel like something is missing. It's anyway, why I can send you a private message. You need to know what happened. Oh, Nancy, call us. Can we flash the number? I'd love to talk with you. That might be better, Nancy. If you want to keep it private, there's no private messaging on YouTube, but maybe Facebook if you're there as well. You could send us a private message on Facebook. We'll keep an eye out for it. But Nancy, if you want to call, I'd love to help you out. There's a phone number. All right. Camille says, is it worth it to have a steroid injection in your hip? Excellent question, Camille. Kamal, I'm so sorry. Kamal, you need to make that decision personally. So an injection in your hip, you're probably talking about like a cortisone injection, some sort of steroid injection with the goal of reducing pain and inflammation. Those injections are super commonly done. And my stance on it is it might be necessary. I'd rather you avoid it. If you're going to get the injection, just understand what you're getting yourself into. That's my big ask, is that you just are knowledgeable about what it's supposed to do so you have the right expectations. It's only supposed to take away the pain temporarily and really take the edge off. It may not take away the pain 100%. And it's probably going to come back. The doctors themselves will tell you this is going to last anywhere from a month to 3 months. And they won't let you get more than a few a year, usually 3 a year, maybe 4, depending on where you're at. There's laws against this because the medication, the steroid medication, actually breaks down connective tissue, which bone is made of, cartilage, ligaments, tendons, that's all connective tissue. And so if you get too many of these injections, you can actually destroy your joint. So that's the side effect of it. When it might be right to get an injection is if you understand that you need to get certain muscles stronger, we need to fix the imbalance, you're in a lot of pain, and you know what you need to do. In other words, it's just a matter of doing it, but you're missing sleep right now because sleep's super important to heal. Maybe this pain is changing your personality in that you're grumpy and you're not nice to your friends and family, the people that you see all day, your coworkers, whoever it is. In that situation, I think it might be the right step for you to go take some either pain medications by mouth or get the injection for your hip joint so that you can be a little bit nicer. But I still would do all this stuff. You can't escape doing this because the injection doesn't make you stronger in the right muscles. It doesn't offload the joint. It doesn't let anything heal. In fact, it stops the healing process because the healing process, the first step is inflammation. Inflammation has to happen in order for you to heal. So if you're taking a steroid that's an anti-inflammatory drug. It's stopping inflammation. You're actually interrupting the healing process with the hope of being in less pain, but it's a side effect of it. That's why the connective tissue breaks down, because it never heals. So just know what you're getting yourself into if you're going to have an injection. Be careful with it. I'm a fan of, if you can avoid it, great, but there's some situations where it might be the right thing for you. There's been a couple people that I've seen over the years in person that I've said, yeah, sounds like you're in a rough spot. Go get it, but we're still seeing you here in person. We'll stick to our appointments. It's not a free pass to go exercise as hard as you want or walk all you want or resume life as usual. You need to fix this root problem first. But the injection might give you some time. Great question, Kamal. Royce Angel says, why does my glute tightening exercises feel like doing Kegels? Have I got it wrong? Thanks in advance. No, this is good. This is good. So the glutes are really close to the groin muscles, and there's nerves, there's wiring, if you will, that's connecting the two. And even with your abdominals, some people say, oh, my abs are kind of working when I tighten my glutes, or when I tighten my abs, I feel my glutes working. They work both ways. And the pelvic floor muscles, the groin muscles, the Kegel muscles are in the middle. And so it is not uncommon. It happens very, very often where the Kegel muscles will fire when you're doing when you're activating the glutes and the abs too. And this is a good thing, because think about it. If I were to give you a big, heavy load of laundry or some groceries or something, and it was 50 pounds, 100 pounds, and you were going to hold it, what your muscles are doing is not just holding you up and putting your hip in the right position, but around your internal organs, your abs tighten up, your pelvic floor tightens up, and your glutes tighten up, because all of those areas are holding in your intestines and your guts, pelvic floor too. So it should tighten up. I mean, right now, if you were to cough, you should, if you think about it, you should feel your pelvic floor tighten up, because when you cough, you're generating an increased intra-abdominal, within your abdominal force, and so you don't want to leak anything. So your pelvic floor reacts by tightening up. So this is good. Good thing that your pelvic floor Kegel muscles are working when you tighten up your glutes. You just don't want them to be constantly on, just like you don't want your glutes to be constantly on. They need to relax at times too. Great question.
Okay.
All right, up next we have Lainey's Majovitz, and they say, I have another quick question. I take long walks to strengthen my knees, but after a while, my hip starts to hurt. Should I be walking? No, you should not be walking. You should probably be offloading. Now, if you don't have pain at the beginning of your walk, then maybe you don't need to walk then. But if you run into pain during your walk, you hit a threshold where your knee doesn't like it anymore. You're now irritating your knee. And so 2 things. I would want to make sure that you're firing the right muscles when you're walking. That's huge. If you're not firing your glutes when you're walking, stop walking, because you're feeding the problem. You're compensating with other muscles, and you're going to be worsening your knees over time. It doesn't mean stop walking forever. It just means stop walking for a time until you figure this out on how to walk properly with the right muscles, then go back to walking. That's number 1. Number 2 is then you have to think about how far you can walk using the right muscles, what your tolerance is, what your endurance is to walk that distance, and only walk what you can without pain. Because even though you're doing the right form with walking, you're using the right muscles, your muscles will get tired at a point, because they're probably not perfectly strong to last however long you're walking. So you need to let them catch up. You need to go on walks within the range you can tolerate, and do it again and do it again. And you'll probably be lengthening that time you can tolerate, and then walk as long as you want, as long as you're used to walking anyway. So check those 2 things. Are you using the right muscles, and do you have enough? Is your tolerance, are you walking within your tolerance? Are you using the right muscles, and are you staying within your tolerance, not exceeding your tolerance, because that's going to run into pain? Hope that helps, ladies. Great question. Doulos Bond Servant says, hello, Dr. David. I have muscle imbalance on the right side due to favoring left hip irritation. What exercises should I do? I'm strengthening glutes and trying to stretch and strengthen hip flexor. Thank you. Well, I would not strengthen the hip flexor. I would stop doing that. And then I'm glad to hear that you're strengthening the glutes. I would strengthen both glutes, because I got to ask the question of, why is your left hip irritated? Because if you're asking me about your right side having an imbalance, how do you know it's not also on your left? They often develop on both sides. If you have an imbalance on one side, it's almost always on the other side. I can't think of a time that I've only seen a one-sided muscle imbalance. Because when you go walk and do your everyday things, you use both sides. Of course, you alternate, but you're probably going to use your hip flexors and your quads too much on both sides. And so the imbalance develops both sides. However, it's typically just one side that starts to hurt. Eventually, if this keeps going, the other side will start to hurt too. So I would stop strengthening hip flexors and just focus on glute muscles. And if your left is irritated, you might need to offload with this or some crutches or a cane so that irritation goes down so that you can normalize your walking. Very often when people have a painful side, they start to lean on the other side, and then it's just a matter of time before that other side starts to hurt too. And now you're dealing with 2 injured sides instead of 1. And if you would have just offloaded when that first side started to hurt, you'd probably be okay. So number one thing I'd work on here for you to do low span serving is offload. Make sure you got good glute activation, both sides, and then practice that while you're walking. You might, the exercise to be specific is I would just do glute activation, which I'm going to talk about here in a minute. So stay tuned and I'll tell you exactly what I mean.
2 more.
All right, we still got some comments I'm going to get to here. We have Louis Caesar, 8981. He says, I develop lower back pain and both feet point outwards when I walk. The pain is so severe day and night, but I'm trying to avoid surgery. Okay. So I don't know if the feet going outwards is connected to the back pain. What I would want to know here is, I'll just answer it both ways, but if you've always been like that with your feet pointed out, then I don't think that's the major concern here. If your feet started to point out when your back started to hurt, that's a major concern. I generally tell people to point their feet out more because they usually have their feet straight or even in. So my thinking is that you're probably genetically built like this. Like the structure of in the bones of your legs are such that your feet tend to point out. I don't think there's anything wrong with that. What I would focus on then is that you're using your glutes when you walk, that you have glute activation. And then because you have a back problem, what's even more priority for you is that you have good lower abdominal activation. So I'm talking about below the belly button. Because oftentimes people with back problems, they'll think, let me go try and do sit-ups, and they do them, but then the upper abs above the belly button are what get the main part of the fatigue. And below the belly button, the lower abs, they don't get activated. That sets up the back problem. So I would think through this, and I would go work on the lower abs, activating the lower abs, which I'll talk about today too, and then getting the glutes active. I'll hit that as well. And if you can start to do those 2 things, I'm willing to bet that your back's probably going to feel better without you even worrying about your foot position too much. But if you have very turned out, pointed out toes, it might be something that just looks a little extreme, more than normal. I've seen people like that. And so healthcare providers will point it out and be like, oh, your toes are way out, pointing more straight forward, without understanding what muscles are firing and what muscle imbalance you have. And it might be the way that you're built and the way you should be walking with your toes out. So I wouldn't change that. I would focus more so on what muscles are you working, what muscles are you using to accomplish your everyday activity, and which ones are you working on when you exercise. Lower abs and glutes for you. That tends to help back pain tremendously. All right, I think we have one more comment here. We have Marion U. Kirchner. She says, trying to avoid surgery, both knee and hip arthritis. Whew, have been trying suggestions. Why are my calves always tight? It could be a muscle imbalance, a compensation of some sort, Marianne. The hip and knee arthritis are often connected because it's the same muscle imbalance that I'm talking about very often, where it's weak glutes that set up over dominant hip flexors. One of those hip flexor muscles is called the rectus femoris, which is a quad muscle, a muscle on the front of the thigh, and it often sets up too much compression to go to the knee joint too. And so if you have weak glutes in the back of your hip, over dominant quads, something else that happens is in the feet. You might get over dominant calf muscles because of weakness in the toe flexors. This is another imbalance that happens. So when you get weakness in the toe flexors, The toe flexing muscles, the ones that curl your toes, they can help the calf muscles when you like do a heel raise, when you tippy toe. But if you don't have good strength from your toe flexors, then the other calf muscles, the ones that mainly drive you up to do a tippy toe, to do a heel raise, are the ones doing all the work, and they can feel overused and feel tight as a result of that. So I would look at toe strength. That's a very common problem that happens with people with hip arthritis and knee arthritis. Hope that helps you out, Marion. All right, guys, we have the helpline open. The number's right here, 915. That's the El Paso area code right here, 200-4159. 915-200-4159. Call us up. I'd love to answer a question. If you have a burning question for me to help you out, if you want to tell me a little bit about your situation, I'd love to give you some specific customized advice. Great call. Great comments, and please give us a call, guys. I want to help you out. Let's come back over here. Let's do day 60. So we did days 0 to 30. Let me write that up. 0 to 30, and now we're on 31 to 60. It's going to be 61 to 90 over here. All right, so we did the imbalance, did the x-ray, thigh fidgeting. All right, let's go over here. So we're going to talk about this now. You need to quit walking. Now, this could even go in day 0 to 30, but I put it here because after you start to feel better, you've been offloading, it's very common for healthcare professionals to start to say, oh, you're feeling better? Go walk. Walking's excellent exercise for hip arthritis. And no. I want to stop you from walking because we have to do some other things first. But let me just describe what's happening here. When you walk, there's certain muscles that should activate to take the steps. I get into it. I'm going to tell you about it here next. But if you haven't thought about it, if you haven't considered it, if a healthcare professional hasn't told you to specifically fire certain muscles that I'm going to mention here next, then you have no business walking right now. And even though it may not hurt to walk, it may not bother your hip more, you're working out certain muscles that are already dominant and taking over your walking pattern. And it's just a matter of time before you walk yourself into a stronger muscle imbalance that then sets up worse hip pressure and a wave of pain that comes with it that puts you out. I can't tell you the number of people that I've seen that start walking and they say, oh, this feels great. And the reason why it feels great at the beginning is because usually they haven't been walking. They've been resting and sedentary because of their hip pain. And then they start to walk at the recommendation of some healthcare professional. And there's research to back this up, by the way. Within anywhere from 0 to about 4,000 or 5,000 steps, people feel better. But once they start hitting closer to 10,000 steps in a day, they start feeling worse. And the reason for that is when you feel better at the beginning, I think because you're loosening up the hip joint, that's beneficial. You might also feel like, wow, I've been outside in a while. I haven't been to this park or been around the neighborhood. I haven't gotten the endorphins going as I'm walking. And that just feels good. But then as that muscle imbalance worsens because you've been using the wrong muscles to walk and you haven't put in the time and effort to figure this out and how to walk properly, as you pass 5,000 steps, you get into 7,000, 8,000, 9,000, 10,000 steps, then that joint starts to get worn and aggravated and irritated, and then walking starts to hurt. So I would rather you stop walking. I tell people this all the time. Quit walking for exercise. Only walk what you need to do your daily activities. In your home, you gotta go to the bathroom, you gotta take care of the kitchen, the laundry, you might need to go work. That's obvious. You need to do. If working involves you being on your feet and walking a lot, try to make the adaptations. And then when you do need to walk, offload, please, so that you're not aggravating it more. You can take some pressure off. This is going to buy you more walking time to do what you have to do. But what I would strongly advise you against is going on an intentional walk for exercise with the intention of helping your hip arthritis. It is shooting yourself in the foot. You're only going to make it worse. And you're walking yourself into a hip replacement. So just quit. Quit for a short time. You can come back to it, though. In fact, I want you to come back to it. Just first, let's take care of two other things. The first thing I want you to take care of is to activate your glutes. I'll put it here. You need to fire the glutes. Get them to turn on, get them to burn. And the way that I want you to do that, there's a specific, some steps that I want you to go through. So do it with me if you can here. If you're sitting down, I'm gonna assume you're sitting down. I'll show you some other positions here in a second. But if you're sitting down, what I need you to do is think to tighten up your butt muscles, your glutes. Make them flex, make them stiffen up and work and hold it. The hold is really important because when you hold, you're waking up more of the muscle cells back there. You're sending brain signals down to the muscle and telling it to turn on. And when you hold, you keep sending the signal down. And so it gets the muscle to fire more effectively. Okay, now that you've been holding it, we'll go about 10 seconds. Relax. Then take a moment and then repeat it. Hold again, tighten your glutes. And now think, do you truly feel your glutes working? Or do you feel thigh muscles working? Because that frequently happens. When you tighten up your glutes, these muscles start to tighten up. You might start to straighten out your legs here. That's not good. That means you're using your quads here. That's not glutes that straighten out your legs. Glutes should just make you go straight up like this. In fact, they make your thighs want to turn out slightly. So your feet might want to come together. And of course, you can see me shifting up a little bit. That's because my glutes are thickening under me and raising me up slightly. And I feel my glute muscles working. First, start with that. And then you have to do the brain gymnastics, the thinking hard about getting just the glutes to fire. And so my recommendation for you, if you're not great at this, is to think about it in percentages. If you think about a 100% glute contraction and you feel your thigh muscles also contracting, that's too much. Back off to 50%. Just do a 50% glute contraction. And if you feel that your thighs are okay, they're not working, good, other muscles aren't working, then see if you can take it up to 55, 60, maybe even 80%. Climb up in percentages and find the threshold at which you can fire your glutes and hold it for 10 seconds before you pass that threshold and other muscles start to fire. And what you'll find over time is your threshold will move. You'll be able to go from 50% to 80% to 90+%. That's when you're in much better shape to do glute exercises consistently and in a way that's productive, where you're not going to fire other muscles and make that hip muscle imbalance where your weak glutes are affecting the pressures inside the joint. You're not going to flare that up. You're not going to make that worse. You have to master proper glute activation without thighs taking over, without hip flexors taking over, so that you can productively walk and do other things. This is not taught by healthcare professionals. What they do instead is they just put you on the treadmill and have you walk. They tell you to start a walking program on your own at home. Go to the park, walk around the mall. They say things like that, and there's zero instruction on which muscles to use. And you might need to not even walk and just start with this right here. So what I want you to do is get obsessive. Let's say you've gone through the first 30 days, your pain's coming down, the offloading's working out for you, you're thinking, okay, I see how the glutes are important. You've been doing the thigh fidgeting. Next, what needs to happen is you can back off on those things, and now instead of thigh fidgeting every hour, I need you to tighten up those glutes, find that right percentage where you're not passing that threshold, hold it for 10 seconds, and do 10 reps, holding for 10 seconds. That'll take you a few minutes. And then do it every hour until you're confident that your glutes are working for you. They're working the way they're supposed to. Another level to reach as well is being able to fire just one glute, just my right, and keep the left relaxed. And then switch to the left glute firing and keep the right relaxed. If you can alternate glute contractions on each side, you're getting really good. This is important because it's going to help you with walking especially. So fire the glutes, activate the glutes without the thighs, and then activate the glutes left from right independently. Huge, huge benefit for you guys. It's a milestone that we have people on our hip arthritis recovery program cross. You cannot progress in our program until this happens, because we see it as so important as a important milestone in order to be able to do the rest of the exercises that are coming. Because if you can't confidently fire those glutes, by default, you're going to use the wrong muscles and you're going to make your hip worse. This is why people get worse over time, despite doing physical therapy, despite doing the exercises, despite doing a walking program, because they don't fire the right muscles. You need to get your glutes working, guys. Let me show you the next one. So activate glutes within 31 to 60 days. We also want to activate the abs, the abdominal muscles, lower abdominals specifically. And the reason for this, let me show you on the skeleton. So I showed you where the glutes were on the back of the hip bones here. But what you need to know about the abdominals, the lower abdominals, so the abdominals attached to the rib cage right here, and then down to the pelvis bones in the front. All that is abdominals. The belly button's at about halfway between the ribs and the pelvis bones. So it lines up with the third lumbar vertebrae, typically the belly button for most people. Below the belly button, in this zone right here, above the bone, the pubic bone in the front, those muscles directly connect to the rim of this pelvis bone and the front of the pelvis bone. And when they tighten properly, they can pull the pelvis bone forward and anchor it, give it a good solid foundation for the glutes to work in the back. They work together. So you might be hitting some success with the glutes, but sometimes people run into a wall, they run into a barrier because they're saying, well, my glutes are working and I'm trying to use them as I'm doing this exercise, but I'm still running into pain. It might be because your abs aren't working. Now, going back to the question I had about back pain earlier, those lower abdominals, when they fire properly, they take pressure off your lower back by tipping your pelvis properly. So oftentimes people with hip arthritis have back pain too. Back arthritis, stenosis, sciatica problems that are coming off the back and contributing to the hip problems. And these nerves getting pinched could decrease the function of the muscles down into the hip and leg. So it's super important for you to get your lower abs working. The problem is when people go do abdominal exercises, they often use the upper abs above the belly button and skip using the lower abs. But I'm going to show you how to make sure you're using the lower abs. Let's move this aside. Here's the trick here. I would recommend lying down, bed, floor, wherever you're comfortable, and you have to get good at this motion in your we call this the pelvis, your hips kind of. You have to rock forward and back. The way to think of this is if you're standing, it's like you're sticking out your butt and then tucking your butt in. You're doing this motion here, like a hip thrust type motion, but lying down with your knees bent like this. You're sticking out your butt right here and then tucking your butt in. Because when you do the tuck your butt in motion and you're pushing your hips forward, that's when you engage your lower abdominals. You activate those muscles below the belly button and you're doing what you need to do to fix hip arthritis. Another way of saying this is when you do that butt tucked in position, what's happening in your lower back right here is you're pushing your lower back down against the surface that you're on. So when I stick my butt out, I'm lifting my back up or arching my back. But then when I tuck my butt in or shove my hips forward, same thing, you're flattening your back out. So when you flatten your back out, you should also feel your abs work. It's the same maneuver. In the physical therapy world, they call this a posterior pelvic tilt. You don't need to know that. I'm just saying that to connect it in case some of you guys have been told that. It's the same idea. You're doing a posterior pelvic tilt or a forward hip thrust, back flattening. All of that I said is the same exact maneuver. The point is to fire your lower abs. If you can feel those lower abs tightening, hold it here for 10 seconds to get that signal to the muscles, then you're activating your lower abs and you're on the right track. What needs to happen next is you have to be able to activate your abs in sitting. You have to be able to do that back flattening maneuver here and feel your lower abs below your belly button stiffen up, tighten up. In standing too, when you stand up, you should be able to shove your hips forward slightly like that. You see how my back flattens, my butt gets tucked in, but my lower abs right here are doing the work. And you might feel it working with your butt muscles, with your glutes, They work together, remember? They should both be activated. This is key because now whenever you're standing, if you're doing the dishes, if you're cooking a meal, you're chopping, you're at the stove managing the pots and the pans, you need to be thinking, instead of sticking your butt out while standing there, that might be your default standing posture. That's using your hip flexors more than your glutes. Shove your hips forward like this, and now your abs are active and your glutes are active just a little bit, like 10, 20, 30%, and maintain this as you're doing whatever you're doing, as you're washing your hands, as you're folding the laundry, as you're waiting in line at the store, at the mail, at the post office, wherever you go. You need to be thinking about sucking in your abs and tightening your glutes consistently throughout the day. That's what needs to be worked on throughout day 31 to day 60. All right, guys. I just want to remind you, the helpline is open. It's on right now. Please call us if you have a question. Here's the number right here. It is 915. There it is. 200-4159. Give us a call. I want to help you out if you have a burning question. You just want to talk to me for a minute. I want to talk to you too. Let's come back over here, everybody. You want the comments? All right, let me get a swig of water while we transition into comments. Drop your comments as well, everybody. You know, I'm interested to know if anyone has had a hip replacement on one side and is trying to avoid it on the other side. If you have a question to ask me on the helpline, I'd love to talk to you, because that's something that happens that isn't talked about a lot, because sometimes people are embarrassed to share that. It's like they feel like they failed the first hip replacement, or the doctor, had an issue. Sometimes people have an infection. I have a friend who's in his mid 40s and just had a hip surgery done, and he's worried and concerned about that, and I feel for him. So I'm hopeful that he doesn't have to have the other side done as well, because I've had many patients that have had both sides done with revisions too, like where they wore out or they had an infection and they had a second hip surgery on the same side. I have one patient who would proudly come in and tell me, I've had 3 hip replacements and only have 2 hips, because he had a revision on one side.
Okay.
So I'd love to hear from you guys. Liz Lyons, Dr. Lyons is here. She says, is pain below the knee while sleeping part of hip arthritis or something else? Great question, Liz. Pain below the knee. So I'm assuming like right below the knee joint. Let's talk about that. So here's a knee joint. This is your right knee. And here's the knee cap right there. So right below the knee is typically in this zone. When you have this imbalance that sets up hip arthritis, it's the same imbalance that sets up knee osteoarthritis and other kinds of knee pain, like meniscus tears. This is the meniscus right here. Kneecap problems, tendinitis problems in the tendon right here that connects to the shin bone. It can affect the attachment point right here where this tendon attaches to the shin. So if you have pain in this area, there are so many other things that could hurt. It could be coming from the same exact muscle imbalance that's setting up hip arthritis. I need to say that because there are so many cases of patients that have come into my office where they say, well, the doctor sent me here for hip arthritis. I also had this knee pain, but the doctor said it's unrelated. And they're going to treat that separately. And I'm pulling my hair out and saying, it is definitely related. And let's talk about muscle imbalances. And I explain the whole thing to them. And as we go through treatment, I tell them this: we're going to fix your glute strength, get your glutes to the right strength so that your hip starts hurting, and you're going to see your knee is also going to stop hurting. Sometimes we need to look at the feet, do the toe flexor stuff. Sometimes we need to go up into the abs. But if you have the type of problems that I'm talking about here, you're going to fix them by also addressing the root problem of your hip arthritis. So Dr. Lyons, get on those glutes if that's your main problem here, which I'm guessing it probably is if you have hip arthritis. I love your picture, by the way. Beautiful smile there. Come on over here. All right. Are we set for comments? Great. Who's next here? Let's move this back a little bit. You guys are in the shot. All right. Sorry, we're just transitioning with our camera equipment here. Rick Rick, I don't know if I want to read all that. Sometimes you guys have prank accounts, and I don't want to walk into reading something that's not. Oh, sorry, I didn't read it all. Vernal Ward thought I was having issues with my knee, TKR, which is a knee replacement, but it seems that my hip bone on bone. That it's my hip bone on bone. I think it's likely a future hip replacement. Any exercise that might help improve my muscles pre-surgery. Sometimes you have to have a replacement done. Like I'm not, I tell people all the time, let's avoid an unnecessary hip replacement or a knee replacement. But there are cases where I talk to people and I tell them, guys, this is a little bit too far gone, and I don't think I can help you out. And the way that you know that, if you think of a knee joint, let me use a big skeleton instead. I go by motion, and here's the thing to know. I'll answer your question, Berna. Just let me make this point. If you have good knee motion, in other words, if your knee bends all the way or nearly all the way, because maybe you have a mild limitation that could be mainly related to swelling, and it straightens out all the way too. And same thing in the hip. If your knee comes up towards your chest about the same on each side, even though it hurts, you don't have any massive limitation, and getting there, you're not ratcheting like a ratchet, one of those wrenches, or it's not clicking a lot to get up and down every single time, then chances are your joint in your hip or knee are actually working pretty good. They're just irritated. They're just angry because the muscles are pulling them down too much. They're putting too much pressure on the joint. So if you take that pressure off, you're probably going to free up any remaining motion, get rid of the pain, and fix the imbalance so that you can keep going in life without having a joint replacement. But if you've had the replacement already, you might still have that imbalance, and that could be why your replacement is hurting now. There's other reasons too, but that's a common one that I see is people never fix the imbalance because the doctors don't know about this. The surgeons are going to tell you about the muscle imbalance. Their job is just to replace the joint if they see that it's a situation where they could do it. So even though you have a bone-on-bone joint, you can take the pressures off, restore little bits of lost motion. But so I would encourage you to do that before you go for the replacement. But if you have to have the replacement pre-surgery, I would be working on getting your glutes stronger because it's going to help your recovery afterwards. Because when they cut into your hip or your knee to do the replacement, they have to cut through muscles. A surgery is a controlled injury. They're injuring you. They're cutting you open. But it's done by a professional, obviously, who knows what they're doing, with the hope of you healing better afterwards. But the fact is you still had an injury and you have to recover. So as a result, you're going to be weaker after the surgery for a short time. And in that time of weakness after the surgery, your compensations, your over-dominant quads are probably going to get even more dominant. This is what I see often is people get a surgery done in their knee or their hip, and then afterwards they're worse off because their imbalance gets worse. They never fix the imbalance going into it, and so they just rely on the already compensated muscles afterwards. So my advice to you here, Berna, is work on the glutes like nobody's business. Every single day I'd be doing glute activation exercises, try to do glute strengthening exercises so that when you go into surgery, you have a better shot to come out of surgery having stronger glutes. And it'll help you in your recovery time. It'll reduce the recovery time. I've seen that happen when people that do it successfully. It's rare. It's rare people are doing anything before surgery. So it's very forward thinking of you, Berna. Great job. Get another comment. Oh, we got a call. Fantastic. Taking a call from Kathy. She's coming over to me in Missouri, and she's got a question about hip thrusting exercises. So let's see what Kathy's got for us here. Fantastic. Hey, Kathy. This is Dr. David. Are you there?
Dr. David. Hey, I'm here. Can you hear me?
Yes, I can, Kathy. Welcome. Nice to meet you.
Thank you. You too, and I've been listening to you for a long, long time, and you've helped me a lot, Dr. David. You're just from God. You're just a blessing.
Just doing what I'm supposed to be doing. I'm glad that it's helping you out.
You are. But I was just telling Amber, I started favoring my left side because that's where the hip irritation was, and now my right side is where the pain is. and it
Mhm.
caused me to have anterior pelvic tilt too.
Okay.
My butt was sticking out.
Yes.
I looked terrible. I mean, it was awful. And my daughter was trying to help me. I was saying, you know, am I straight now? Am I straight now? When I was trying to walk.
Uh-huh.
You know, but what you just said, that light bulb went off in my head, and it helped me because I'm one of those people that struggle a little bit with where is my lower abs? How do I tighten those?
Yeah.
You know, they say, you said about act like somebody's going to punch you, and that
Yeah.
helps. But when you said that about thrusting out those hips, which is what I started to try to do to get rid of the anterior pelvic tilt, but it was
Yes.
hard, and I couldn't make it work. But when you said I tighten, I'm sitting on my chair, but
Mhm.
I tighten my glutes and I thrust my hips out at the same time,
Yeah.
and my lower abs tightened,
Yes.
and it took care of everything. The lower back pain goes.
Fantastic. That's
Yeah, so
awesome.
it was just a great explanation. But when you said that about, because somebody that doesn't have this issue isn't going to understand about thrusting your hips out, because most people don't ever think of that. They just walk.
Yes.
You don't have hip problems, you just walk. But I've got this on, you know, my left hip. You know, I was one of those people that they did the X-ray, you know, and they said I would need a hip replacement on my left side, and I ignored it, and I found you. And, you know, but I did get anterior pelvic tilt, and that I could, you know, I struggled. But I just wanted you to know that, you know how when somebody says something and it just wipes away
It clicks.
It clicked.
Mhm.
It clicked.
Yeah, I get you completely.
Thank you so much. Thank you so very much.
Absolutely, Kathy. I'm glad that it clicked for you. That's great.
Yeah. And somebody put in the comment, Christy asked, aren't those pelvic tilts? And they kind of are.
So sorry, I lost you for a second. Say that again about the comment, Christy.
Well, Christy said, aren't those pelvic tilts? And they are. You're thrusting your hips out.
Yes.
And it feels like at first it's going to hurt, but if you can just encourage yourself to do it. Yeah. And even when I'm standing at the stove, like you said, that's what I'm going to do. Yeah,
you're on the right track, Kathy. Sounds like you now that it clicked, you have a whole opportunity in front of you to fix this problem and get far, far away from ever having a surgery. So I'm so happy for you. That's fantastic.
Thank you, Dr. David. Thank you so much.
Absolutely. You're welcome. Nice to meet you, Kathy. Bye-bye.
You too. Bye-bye.
Thank you so much. All right, let's come back over here. Great call from Kathy. She was updating me. She was updating me on the hip thrust. I'm so glad that worked for you. And you know something that I say this. I'm the first time I'm ever gonna say it online and live. But I'll give the G-rated version of it because I use probably the R towards X-rated version of it. But this is a hip thrust maneuver. I'll just say that. You're thrusting your hips forward, and I tell people, think of when you might do that in a situation that's not G-rated, and it makes your butt muscles tighten. Now, get your mind out of the gutter and go back to just fixing your hip arthritis. If you can get those glutes to work, you're on the right track in fixing the imbalance so that you can correct that compensation that's been leading you to hip arthritis. And I went there for a moment to the not G-rated thing because for some of you guys that might click because I've said that in front of patients and they're like, oh, I was talking about okay, it clicked now. I can fire my glutes. I know what you mean. Now I'm on the right track with you. And so like Kathy had on the phone a second ago, I want you to have that light bulb moment where you're like, okay, I know what an anterior tilt is where I stick out my butt, and I know what a posterior tilt is where I thrust my hips forward, that not G-rated thing. That's what will make your glutes work properly. And once you just go through that mental exercise of figuring out what muscles are working and what position your bones and hips need to be in, then you've unlocked it. And now you can begin to properly activate the glutes in sitting and standing and lying down and and walking and doing the dishes and all the everyday things that you do. And then you can get your abs working with it and you're on the right track. That's going to unlock day 61 to 90. Are we going to go here next or go to comments next?
Yeah.
All right, let's go to day 61 to 90. I have the marker with me here. And this here, guys, is where we need to learn to actually relearn how to walk. And that's why I have a little walking person here. All right, so remember I said quit walking over here, but you're going to eventually learn to re-walk, but you have to first activate these muscles properly. You have to have that light bulb go off like Kathy did. You have to make sure that you can alternate your glutes activating left to right, because when you relearn how to walk, that's critically important. You have to think about this, all right? So follow me. I'm going to tell you how to do this. When you step with your right foot and your right foot plants on the ground and you begin to bear weight on that right foot, your right glute, your right butt cheek should tighten up a little bit, like 20, 30, 40%. Not 100, less than half. It's slight. I can't give you an exact number. That's why I'm giving percentages. It just needs to activate a little. While you're bearing weight on the right foot, it should be active. Then as you take a step with your left foot, as your left foot swings and you start to put weight on that left side, the right side is going to start to relax, and the left glute, the butt on the left side, should then kick in. So you're alternating. When you go back to step on the right foot, right glute kicks in. And then you step on the left foot, left glute kicks in. And that's how we should be walking always. Take a right step, right glute. Left step, left glute. Feet muscle should also be activating at the same time the glute activates. So if you step with the right glute, your right foot muscle should just engage a little bit. And your abs, critically important here, they should just be pulling you into that slight forward hip thrust position by tightening up in those lower abs and just maintain it the whole time. Because what happens when you have very weak abs is your spine goes crazy. Here's what I mean. If you think about a straight line between my belly button and my nose right here, this is my spine, essentially. And if you don't have engaged lower abs that are balancing out your hips, you're going to sway in your spine here. So when you start taking steps, the hips start to swing back and forth because your abs aren't controlling it and they're not giving your glutes a good foundation to work from. That tends to happen to women because they have wider hips. But what men do sometimes is they start to walk and they teeter-totter side to side. Sometimes women do this, and sometimes men do the hip thing too. But if you tighten up the abs, what you should see is less side-to-side motion in the hips or less side-to-side motion up top in the shoulders. What this does is gives your glutes a good fighting chance to work when you're walking. So relearn how to walk, practice this, and I tell you, I can tell you with complete confidence, all the people that I've taught how to walk again with the right muscles to fix the imbalance, to help hip arthritis, they are struggling at the beginning. Some people get it pretty quick, like within a session, with one PT session. Other people take a couple of weeks of practice and rehearing it, and then it finally clicks, the light bulb goes off, and then they get it. But once you get how to walk, you have a whole new world ahead of you, because now you can turn the laundry, going back and forth to the laundry room, into a glute exercise. You can turn the trip to the grocery store into a glute exercise. Now it's productive for you. And I get so excited about it because before you went through the glute activation and abdominal activation, when that wasn't working right, walking was not productive for you. It was harmful. That's why I said to quit it. But once you've gotten this going and you figured out how to walk, I tell people, go walk now. Walk a lot as long as it's not hurting you. But you're going to get better. As long as you involve the glutes and you're doing the feet and the abs correctly and you put it all together and it becomes casual, because at first you're going to feel like a robot trying to fire your muscles properly. But you get over that, and then it feels more casual and nobody knows that you're doing it. And then you get to enjoy life a lot more. So I get super excited when people get to this point. And your hip's going to feel tremendously better. You're going to be way farther away from having surgery. All right, guys, we have another call here. We have Desmond St. Rose from St. Lucia, who's got a hip problem. I'm going to take that call. We're coming over here. All right. Get situated here. Desmond, are you there? This is Dr. David. Desmond, are you there? This is Dr. David.
Yes, Dr. David. Yes.
Hello. Thank you for calling from St. Luca. It's a pleasure to have you. Nice to meet you.
Yes, same island as Julian Alfred.
I'm so sorry. Say it again.
I am from the same island as Julian Alfred.
Julian Alfred. I'm not familiar, but
She's the Olympic gold medalist in the 100 meters from the long haul.
Oh my goodness. Oh, from my university. That's awesome. I haven't kept up as good as I should, as you can tell. Well, that's fantastic. I know where you are in the world, though. That's fantastic. Very beautiful place.
Okay.
I've never been. I hope to one day.
Okay.
How can I help you?
I did an X-ray of my right hip 2 weeks ago,
Okay.
and the doctor said that it's severe. It's like on a scale of 1 to 4, it's on the 4.
Okay.
And he's recommended that I do surgery, which I don't want to do.
Okay.
And it's only because I've been watching your videos of late.
Mm-hmm.
And I said, I need to see you or send you my X-ray
Mm-hmm.
so you can determine if, well, Desmond, should you do it or Desmond, don't do it. And you can do the exercise instead. I wanted you to view my X-ray if possible.
Oh, it's going to be kind of hard, but let me ask you some questions here, Desmond. How is your hip moving right now? Can you bring your knee towards your chest on that side, on that right side? Does it come up the same as the left?
Yes, it does.
Good. Now,
The only thing though, I can't walk properly. That's the only thing. There's pains a lot when I walk.
okay.
I went to a chiropractor. He's been manipulating my knees backward, and there isn't much pain, surprisingly.
Good.
It's only when I walk.
Okay. Got it. Now, let me ask you another question. If you were to move your leg out, like towards the side, does it move the same amount on the left versus the right? Like if you're to open your legs?
No, it's very restricted.
Okay. And then how about moving your leg behind you? Like if you're kicking back behind you, can your leg move about the same on each side?
On each side, yes.
Okay, so you just have
Yes.
it sounds
No.
sideways no, forwards yes, and backwards yes, but not sideways.
Correct.
Got it. That right there tells me that you probably have good potential to improve because the joint of the hip is moving. If you can move that hip forward, which is the most important motion to have, and then you can move backwards, which is second most important. You can bring this hip joint backwards, hip extension is what we call that. Now, out sideways is also important, but kind of less important. My guess is that you probably have this muscle imbalance when you go to stand and walk. That's when it's hurting you because you might be using the wrong muscles. But I would go strengthen the heck out of your glutes. You might need to be offloading right now because if walking's hurting you, stop walking, get on a walker or crutches. And this is a good testing fact. If you get on the walker or get on the crutches, give it a few days, 2 or 3 days. Every time you're on your feet, if your pain goes down significantly and some motion comes back, moving your leg out to the side, then I think you have an excellent shot at avoiding surgery completely going through this process like I've been describing here in this video. Or if you wanted to do something like our hip arthritis recovery program, which is way more detailed than this and a heck of a lot more help, you would probably benefit tremendously and heal without having to have a surgery.
Okay.
The motion's a big deal. What the doctors will do, let me tell you this part here, is they will tell you to go, they will tell you that your x-rays, bone on bone, stage 4 hip arthritis, that's what they're supposed to do. But then they're going to connect that to your pain. And if you start talking to them about how much pain you have when you walk, they're going to start thinking, all right, Desmond's a good candidate for a hip replacement surgery. Let me recommend that. That's what they're trained to do. But what they're not trained to do is to tell you what I'm telling you here is if you have good motion, if you do some things to get the pain down and it works, then you need to work on that angle. Work on the angle of trying to heal naturally. Now, I want to make sure that you know we have phase 1 for the hip arthritis recovery program for free on our website. You should go check it out. Oh, we put up the website there. Go to this website if you can see the live stream right now. It's epmanualphysicaltherapy.com, and you can start working on our hip arthritis recovery program, the first phase, which is what you need right now, based on what you're telling me.
Okay, on phase 1, you said.
Yes. Yeah, it's up there for free. You don't have to log in. You don't have to get an account. You don't have to pay a single dime at all. It's just on the website. You just load the website and it's there. You can start playing the videos and start going through it. Yeah. Start there, Desmond. And if you start to get better, that's good news. That means you got some work ahead of you. You got to get the glutes active. You got to get the abs active. You got some things to work on, but you have a fighting chance at avoiding a surgery.
But Doc, can I still send you my X-ray image? Can I still send it to you?
Yeah, yes, you can send them to us. The best thing to do is find the contact us form on our website, or you can also, we have a little chat, a website chat. You can ask it about sending us the forms, and you'll get the instructions on how to get us the x-rays. And, we can't get to everybody, but we do our best to try to help everybody that we can within the limits that we have available to us.
Okay.
Mm-hmm.
So
Great.
thank you very much. I do appreciate your time.
Absolutely, Desmond. I wish you the best of luck. I hope this hip pain goes away and you're back to doing everything you love to do, enjoying your beautiful town, your beautiful country.
Okay, thank you.
Have a great day. Bye-bye. Right. Good call. I hope Desmond gets this problem addressed and utilizes our phase 1 for free. It's something that I forget. We don't talk about that enough, guys, but we have all of phase 1 for free. And on that same page, this is I have an example here. This is for our knee. We also have a knee arthritis recovery program. Phase 1 is also free. It's also on our webpage. Oh, there's the page right there. epmanualphysicaltherapy.com. Once you load that page, you'll see the option to go to the hip program or the knee arthritis program. And there's a bunch of free resources we have. We have a case study that you can download. This is for the knee, but we also have one for the hip. And what I did is I've seen a lot of patients over the years, and I've taken one patient for knee arthritis and one patient for hip arthritis. Interviewed them. I took down all their information. I pulled out our notes and I put all the details of the treatments that we did with them to progress them from having severe hip arthritis pain for our hip patient. I think it was Brenda. And then we went all the way to where they're walking, doing whatever they want to do, exercise, enjoying life. And so that's available as well on our website. And if you go to the page where we have the free phase 1 for hip arthritis, we have phase reports, because there's a quiz on there. You can take a quiz. So we have, let me show you our board here. Here it is. In our hip arthritis recovery program, we have it divided into 4 phases, similar for the knee arthritis recovery program. And a lot of times people are wondering, what phase am I in? And this is important because there's certain exercises that go with each phase. So I've kind of been following it here on this, like day 0 to 30 is pretty much it's similar to phase 1. There's way more information in the program. And this is for free, by the way. You can get access to phase 1 on our website for the hip arthritis recovery program. But there's certain things that you should do here that you don't need to be doing in later phases. And if you're trying to do exercises from phase 2 or 3 or 4, when you technically should be in phase 1, which I tell you how you know if you're in phase 1 here, then you're gonna hurt yourself. They may be good exercises for you to do later, but if you're doing them at the wrong time, it's gonna make you worse. This is why a lot of people don't know how to rehabilitate somebody with hip arthritis, because they'll say things like walking is good for you. Well, we don't do walking until phase 2. Many of you guys watching right now are in phase 1. If you go into my program there that's for free, you'll see why. I explain all the details to you. So anyways, you can take that quiz. It'll tell you, answer the questions. It's like 4 or 5 questions. And then you can get access to a customized report for the phase that you're in. This is for the knee, but we have another one for the hip arthritis quiz as well. So you can get more details on what you should avoid, what you should be doing, just about what the phase is like. It's like a 20 to 30 page report, depending on what phase you end up qualifying for. So it's just helpful information, resources for you guys to be able to better wrap your head around the muscle imbalance, what phases you're in, the hip arthritis recovery program, which exercises to do. My goal is to provide as much as I can for you guys for free, like this live stream, our phone calls, so that you can move along and make better decisions about your hip arthritis. All right, let's keep going here with number 9. And here's what I want you to do here. We need to do glute squats. I love squat exercises. I put my leg here because you're going to use your leg muscles in those glute squats. And I'm going to move the table as well. Let me rearrange just a bit here for you guys. When doing squats, so many people don't think about what muscles they're using. They just start bending their hips and knees. And they often do it the wrong way. Which, like walking, they're using the wrong muscles to do the squat maneuver. So they're often squatting like this, where they're sticking their butt out back, and they're calling this a good squat. I see so many fitness people on social media telling people to do squats like this, and if you do it yourself, if you just get into a squat position with your butt sticking out like this, which is a big no-no, you're going to feel your thigh muscles working hard. Just get into this position and hold a little bit. Be careful if you have hip pain or knee pain or pain somewhere. And what you need to be doing instead is shoving those hips forward, that forward hip thrust, to tighten these glute muscles behind the hip, and then come straight down. So a squat should look like you're dropping your bottom down towards your heels, and your knees and feet should be kind of wide. And it should feel like you're using your glutes. That's why I call this a glute squat. Now, squatting like I'm squatting might be a little much for you, so what I recommend you start out with, if you're in this range of 61 to 90 days, is a mini squat. Hopefully by this point, you should have been able to activate your glutes on command. You should be walking pretty well already. You should be able to quiet down your thigh muscles, have good control, have that conscious control over your glutes and quads. And what I recommend you start out with is just a mini squat. So I'm going to show you the side view here. I'm just putting my feet about shoulder hip width apart, comfortable, toes out slightly. Then before I even drop down, what I'm going to do is activate my glutes by doing that forward hip thrust maneuver, keep my abs active, and then from here, I'm just going to slightly bend my knees. This is a mini squat. But I feel my glutes working. I feel my lower abs working. These two muscle groups are key in getting your hip to be properly loaded so that you're not making hip arthritis worse. I'm going to hold here for 10 seconds and let these muscles get tired, especially back here, both sides. Let me show you the back. So before I even drop down, I'm just tightening the glutes, sucking in my abs, flat back here, and then I just bend my knees a little bit. Glutes are still working. Let me show you the front. I'm forward thrusting, activating the glutes back here, sucking in the abs, and then bending my knees. And as you get more comfortable with this, you should feel like you can drop slightly further without any problems, without the hips hurting, without the knees hurting. If you do feel problems, you're not ready for that yet. You're starting to compensate likely, or your joint just needs a little love, a little time to heal and recover and stay at a higher position, but still get your glutes to work, get your abs to work. 10-second holds is an excellent place to start at, just to wake up the right muscles in the different ranges. And as you get better, you might go a little lower. I'm opening my feet a little bit. That just feels like it's right for me to get my hips in the right position. And then opening your knees out wide also makes you activate your glutes. As you go lower, you have to consider that. And you could test this out. If you bring your knees in, glutes shut off. Quads turn on. That's not good. That's going to feed into that imbalance. So if you shove those knees back out and make sure your hips are forward, glutes turn back on, and quads turn off. That's what we need. After you get good at the holds, this might take you weeks, a couple of weeks, maybe more. Then you can start to work on reps. But I would not go into reps until you feel confident that every time you come down and you reach this down position, your glutes are working at the down position. And then when you come up, you should tighten those glutes for a moment at the top. So you need to tighten at the bottom, tighten at the top every single time. That way you finish your reps of your squats, because you might be shooting for 20, 30, 50, 100 reps a day. You might do a little bit at a time spread out throughout the day, or you might do them all in one shot. Depends on what level you're at. But as you get better at doing these glutes, these glute squats, you should feel like you finish your exercise and you should say, whoo, I feel it in my butt. Minimally in my thighs. You'll feel the thighs working. They start to work. Just a quick side note, I often get told, he's all about the butt muscles and never works out the quads. But inevitably, you're going to work out your quad muscles when you get to here. I just want you to get to doing these squats being glute dominant rather than quad and hip flexor dominant, because that's going to feed into your hip arthritis problem. If you make them glute dominant and constrain and force yourself into doing squats with glutes the whole time, then you're setting yourself up for the best pressures to be going through your hip joint so that you're healing the hip and strengthening the muscles around it in a way that's productive for you, in a way that you can keep up for the long term so that you're not making your hips worse and worse as you exercise. Our clients that go through our hip arthritis recovery program, they go through this type of exercise treatment approach that I'm telling you about, they get in contact with us months, years later, and they say, I'm still good. Because this stuff lasts, because we're fixing the root problem. So we have to do glute-focused squats. That's number 9 here. We have another call. Can I just stand? Is that okay? Can I just stand here? All right. I'm going to ask my team. My team tells me where to be, where to stand. I trust them. I just have to make sure I help you guys out with the hips. Coming over here. All right. We have Rita. Can I see? Rita from Dixon, California, who's got a hip imbalance. Rita, are you with me?
Yeah.
Hi, Rita. Nice to meet you.
Nice to meet you too. I have a quick question.
Go for it.
Everything that you're saying is just perfect for me. And what happened to me was 2 years ago. I fell off of my motorcycle, but I was just parking it, so it's not really moving.
Oh, okay.
I had MRI and X-ray. There's no fracture in it or anything.
Good.
But I'm still having problems with it. And the thing is, I think you're right. I'm having muscle imbalance.
Mm-hmm.
And I really need to work on my glutes. I've been trying to walk as much as I can, and like you said, walking. Like you said, to quit walking for right now. So I kind of understand it a little bit right now.
Yeah.
So I want to see if it's right for me to take your hip arthritis class.
Uh-huh.
Is that perfect for me to take?
Yeah. So the best thing to do, Rita, would be to go to our website and find where we have phase 1 for free for our hip arthritis recovery program, and start the program for free so that you can try it out.
Okay.
That way, if you find that you start applying things and it's working for you, and you want to keep going further into the program, then we could talk to you at that time about signing up to be a paid member of the program. Now, some people just want to jump right in. That's fine too. It sounds like you're a good person to have in our program, like you would benefit from it. But if you're unsure, if you want to try things out, that's why we made that phase 1 for free, so that you can apply it and see if it's going to work out for you. And if you have success in it, chances are the rest of the program is going to be even better for you. We consistently see that. So that I'd start there.
Okay. Well, thank you.
Yeah, absolutely. Do you know where to find the website? It's epmanualphysicaltherapy.com. It's up on the video right now, so that you can find it. Just screenshot it or rewind, and you should be able to get to it. Or you can also just on Google on your phone, just type in, or on your computer, El Paso Manual Physical Therapy, and we should pop up right away.
Okay, got it. Thank you.
You're welcome, Rita. Have a wonderful day. Nice to meet you.
Nice to meet you too. Bye.
Bye-bye. Awesome. Great. So Rita, that's tough when you have an accident like that. Thankfully, Rita wasn't hurt in a moving vehicle accident. That's not good. Rarely ever good. But anyways, she just got caught in her motorcycle while parking it. So that's a much more manageable situation very often. But if you have questions like Rita, like Rita did a second ago, where you're wondering, is the hip arthritis recovery program right for me? Guys, that's why we've made all these free resources for you to try it out, because we want to help you guys out. We want to make sure that you have an opportunity to give it a shot, see what it's about, see what's entailed, because there's a commitment level to it as far as your time and your effort. Like, I mean, this, even just this program that I'm writing to you about here, explaining to you about here in this video, I'm talking about 90 days. Hip arthritis is not going to be fixed with 2 exercises or even 10 exercises in one day or in a few days. It's a process. That's why we have the hip arthritis recovery program to walk people through that process. And, you know, I wrote 90 days here because this fits most people in our program, but we have some people that go through it faster than this. And then we have some people that take longer than this. And we talk about it as in our program, and we have weekly group coaching calls where me and my recovery coaches are answering questions so that people aren't stuck. We have an online private community where you can log in and ask questions. Our staff helps you out, and we encourage people to help each other out too, and they do. We have an awesome community in our hip arthritis recovery program, and people are so helpful in there. They're creating their own documents, and which I love because that means that they're owning the knowledge parts. You know, we have these forget the X-ray, muscle imbalance. I have these little brains here that probably fall off again. That's okay, but it's important because you need to make sure that you own this knowledge. You can't just do an exercise. You have to essentially get a small degree in fixing hip arthritis, and that's what the hip arthritis recovery program is designed to do. It's designed to teach you, and I love it for many reasons, but because you take away this knowledge, when your hip flares up again later on, you know what to do. That's what our members say. They're like, yeah, I had a flare up, but I'm back. I pulled out the walker for 2 days, and I was good. After that, I was back to stage 3 activities, and I'm moving on into stage 4. Phase 4, I'm sorry, not stages, that's a different thing. Anyways, let's write out this list, guys. Let's wrap this up. So the next part is you need to relearn, a little messy, relearn stairs. And can I borrow that ladder, guys? The stairs are tricky because I often get asked, what is the trick to doing stairs? And I'm going to show you guys the trick. However, I need to give you the caveat of it's not always going to work because it's dependent on you having good glute activation and glute strength and you going through all the other stuff that I went through. This is why this is number 10 on the list. This doesn't come early on. If you have stairs in your home, on the porch to get into the house or inside your home, anywhere in your home, and you find that it's painful for your hip to go up or down stairs, what you need to know is that you're not going to fix it in one day. You need to build strength. And before you build the strength, you need to activate the right muscles. And before you activate the right muscles, you need to calm the pain down. So something like this. But once you've gone through that process, then the way to climb stairs, this is a ladder, of course, we're going to pretend it's a stair. If you're going to take that first step up the stair, you need to be thinking about using that glute. So this is why it requires you having figured out how to activate the glute. When you're going to step up the glute, let me do the other side so you can see it better on the camera here. The glute that's on the leg that you're going to step up with should be activating, it should be tightening up as you go to pick your body weight up. This glute needs to be helping you to drive up, and then to take the next step, then your other glute's going to be activating to drive you up the next step. So every time you step up, you should be thinking glute, 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 just like walking. The trouble, though, is that because you're stepping up and lifting your body weight up, it requires more strength. You need more strength to do this. So we have people in our hip arthritis recovery coaching program that have no problems walking anymore. They're out of phase 1. They don't need the walker or the crutches anymore. They're figuring out how to fire their glutes. Walking's feeling tremendously better. They're starting to walk outside and enjoy their ability to walk without pain now. They're finding the limits still. But some of those people that have stairs in their home, they're saying, the stairs still bother me. Why? I'm firing my glutes. I'm doing it. And then I have to tell them, sorry, you need more strength. You need more. We need to go to those glute squats. You need to work on this. And how much is, I don't know, enough to do the stairs. Because everybody's body's different. It takes as long as it takes. As long as you're willing to have that patience and you're seeing improvements along the way, you're gonna get to the stairs just fine. Now let's talk about going downstairs, because that's slightly different. When you're going downstairs, the leg that's staying behind, so in this case, let me switch legs. The one that's closer to you in the video is gonna be my right leg. This one's controlling the descent. So my glute is activating on this side as my left foot reaches down to touch down. And then it's gonna alternate to the other leg. In this case, it's my left leg coming down and controlling the glute on this side as I descend. So it's kind of the opposite. A saying you might hear if you've ever been in physical therapy, they say this in the physical therapy world or in the surgery world all the time. They'll say, go up with the good and down with the bad, like heaven and hell. So you go up with your good leg, meaning your stronger leg. So you're trying to activate the glute very well. And then you go down with the bad leg, meaning this is your good leg, so you're keeping it back. The idea is you're using your glute on the way up with the leg that's pulling you up, and then you're using your glutes to control the descent down. And you just have to be conscious of doing that. And it just takes a matter of practicing it, which is going to be especially important for you if you have stairs in your home. But once you practice it for a few days, maybe a couple of weeks, then it becomes second nature to you, and you can do it all the time without having to focus on it so much. I have to tell you the story. I had a patient one time who had a hip labral tear that was repaired years ago, got worse. What she was told she needed to have a hip replacement, but she didn't want to have the surgery, obviously. She was trying to figure out ways to get out of it, but she came to me saying, I'm about to sell my house because it has 2 floors and the stairs kill me. And my bedroom's upstairs and the kitchen, the laundry, everything's downstairs. So I'm always going up and downstairs all day long. And by the end of the day, my hip is just miserable. I'm going to sell my house. And she looked at me and said, you're my last hope. If you can help me with my hip, hopefully I can avoid the surgery and keep my house. I love my house, but I'm going to sell it because I can't live in a house of stairs. I got her to activate her glutes. We got the glutes a bit stronger. And then a couple months later into therapy, into her treatments, she came to treatment saying, I can go up and down my stairs at home without hip pain. Fantastic. I'm keeping my house. It was a huge win for her. And so we were so excited for her. We celebrated. And after that, she got into using her elliptical. She had an elliptical at home, and she was like, I thought this was always going to hurt my hips, but now that I can use my glutes on the elliptical, it's like gold for her. She was able to get her exercise routine back, which was important for her to stay in shape. So I can't stress to you how, oh gosh, you guys, so many people get an unnecessary hip joint replacement simply because they haven't activated their glutes right. They haven't figured out how to fire it left to right. They haven't involved their abs. And then they haven't figured out how to do it in walking and in stair climbing. If you can figure those things out, you can probably stave off a hip replacement surgery for the rest of your life. And most importantly, not just survive, and barely be in no hip pain, but thrive to where you can walk and hike and enjoy family and go sightseeing and take care of your house, the simple things. There's so many people in our hip arthritis recovery program who are just enjoying being able to pick things up off the floor without their hip bothering them. They're enjoying being able to rake the leaves in their backyard, shovel the snow in the wintertime, water the garden in the spring and the summertime without their hips hurting. Those are huge wins that just make every day that much more enjoyable. But guys, you've got to go through this process. And that's my final little sticker that I have here is beyond 90 days. So really 90 days to 365 days, 1 year and beyond. You have to make all of these glute exercises, glute activation while you're walking, while you're doing your everyday chores. They need to be a habit. You need to be thinking in terms of, I need to be conscious about using my glutes every day. If you can do that, and it's a daily thing for you, that's how you maintain your glute strength moving forward into the long term so that your hips are feeling fantastic and you can avoid surgery the rest of your life. My staff can see that I am melting here. It's warm in this room with all the lights and everything, all our equipment, it gets a little warm. But thank you guys for following me on this program here. I hope you can apply it. Drop comments. I'm still going to answer some comments here, so stay with me. you have a question, and our helpline is still open as well for a little bit longer. We have maybe like 5 or 10 more minutes, and then we're going to wrap up and call it a day. But let's see there's a helpline right there. So 915-200-4159.
Okay.
All right, whose comment can we answer here next? We've got Marianne's back. If you were firing your glutes/abs, should we be stretching the opposite muscles or ignoring them? Good question, Marianne. I would ignore them. And here's the thing is stretching, it's not a bad thing to stretch the muscles. Okay, so let me say that first. But the amount of effort that it takes to actively stretch and the gains that you get from the stretching they're short-lived. So you might be stretching for 5, 10, 30 minutes in some cases, depending on how much you decide to stretch. But the improvement, the flexibility that you gain only lasts a few hours, a day if you're lucky, versus strengthening the right muscles on the other side of the joint, on the back of the hip. You can exercise it, periodically throughout the day, like I'm saying, and the gains of strength last for days, if not a week or more. So I would rather you spend your time strengthening muscles. And here's the thing: when you strengthen the glutes, there's a reflex in the joint and within the muscles that oppose the joint, like with a bicep and a tricep. It's called the I forgot the name off the top of my head, but the idea is when you contract this muscle it's called reciprocal inhibition. When you contract this muscle, the bicep on this side, it causes reciprocal inhibition. It just means that the other side relaxes, it gives up, it stops holding so that the joint can bend. Similar things happen in your hips. So when you tighten the glute in the back, the hip flexors and the quads in the front, they start to relax and they get used to giving up because they're getting support from the glutes now. This idea of reciprocal inhibition, I use all the time with my clients, and I tell them, you don't have to worry about stretching. You can if you want. It's not a bad thing, but I wouldn't give it as much effort as strengthening. Strengthening by far will give you way longer improvements and cut down the amount of time and effort you have to put into this. But if you want to be an A+ student, a little bit of stretching won't hurt. I don't think it's a bad thing. Just don't start to stretch a lot and avoid strengthening. That's a big no-no. Good question, Marion. Got the helpline open, guys, 915-200-4159. Who else is giving us comments here? Elaine says, can you do a video on high hip? What is high hip, Elaine? I'm not sure what you're talking about. Maybe high hip pain. There's a lot of reasons for high hip pain, or you're talking about an exercise. Maybe Elaine can elaborate a bit more. We have another comment?
Yeah, Christy, 2-part comment.
Okay, we got a 2-part comment coming up. Christy, UG5QE, says, I am glad he confirms with what I have learned about my body full of arthritis, and concluded by studying my hip pain and how it affects my joints. Great. I heard a lot, but doctors just put injections or surgery. Yeah, that happens all the time. And Christy says, I would love some help with the shoulder joint. Right arm doesn't move on its own anymore and full of inflammation. Oh no, I'm so sorry. There's another comment after that. Christy says, I actually have huge swelling around it.
All around it.
Oh, all around it. Injections don't help. I'm so sorry, Christy. That's no fun. The shoulder I love talking about the shoulder. We'll take a moment to talk about it. So here's the ball and socket joint. Let me just put the skeleton over. I think that'll be easier. Should I go over here?
Right.
There we are. I've just talked about the glutes a lot, but the shoulder isn't that different from the hips. It's a ball and socket joint. It's a different shape, obviously. It's not quite exactly like the hip, but there's muscles that assist the movement in the ball and socket joint. And one of the most common imbalances, there's a muscle imbalance that affects a lot of shoulder problems up here: rotator cuff tears, arthritis. There's labrum in the shoulder labral tears, biceps tendon tears, impingement in the shoulder, bursitis, tendonitis in the area. There's all kinds of problems that happen in the ball and socket of the shoulder joint as a result of weak upper trap muscles. The upper trap muscles connect from the base of the skull and the spine up here, the neck bones, and they come out to the shoulder and they help shrug the shoulders up. And the big problem that happens with the ball and socket joint is people don't use their upper traps enough. So when you're reaching up, for instance, you would think that it's all ball and socket joint coming up like on my skeleton here, but this skeleton doesn't show you the right movement, because what actually should happen, what you need to be doing, Christy, is that shoulder blade needs to come up, and you have to voluntarily, you have to consciously shrug. So whenever your hand's about eye level here, you need to start to think to shrug the shoulder up as you come up. And if you reach all the way up, then you should maximally be shrugging. When you do this, the socket in the ball and socket joint, because it's part of your shoulder blade, when you shrug, you move the socket up rather than keeping it down into the side. That's important because now you put less strain, less bad forces on the rotator cuff, on the biceps tendon, on the cartilage, the labrum inside the shoulder. All the structures of the shoulder are pressured normally rather than abnormally. If you don't shrug, then what you do is you take that joint to the end ranges and you put some bad pressures through the joint. But as soon as you shrug, you move that socket up, and it allows the ball to stack on the socket vertically. That's cool. That's a lot. Now you just balance it with muscles. Your rotator cuff doesn't have as much work. It just has to balance rather than yank it up. A lot of problems are solved by just getting stronger upper trap muscles, shrugging muscles, and also learning when to use it, how to use it by shrugging as you reach up. It's proportional. So once you start to pass your hand, your hand passes your eyes, you should begin to shrug gradually. And then by the time you're reaching all the way up, you should be maximally shrugged. And then as you come down, you should gradually let the shrug go. And by the time your hand's about face level, eye level, your shrug can come down. So many people have very rounded shoulders, sunken down shoulder blades. And so their sockets are way down low and they're just shredding apart their ball and socket joint because they don't have good shrug muscles. It's the equivalent of the glute muscles in the hip problem. The shrugging muscles, the upper traps, they're a lot like the glute muscles. I hope that helps you out, Christy. We have a bunch of videos on rotator cuff tears and other shoulder problems like labral tears. We have a few shoulder arthritis videos. And we have a program called the Rotator Cuff Tear Recovery Program as well that might help you out. So I recommend you check those out. They're on our website. If you go into our programs tab, we can take you through the process that's similar to these phases that I had up for the hip arthritis. We've developed a program with the same thing for rotator cuff tears, and it works wonders. We have so many good outcomes from that program as well.
Okay.
Good question. Time for one or two more here. Scuba Nines says, anything to watch out for if also have labral tear in the hip? Good question. So what would you do different, basically, I think is what you're asking, if it wasn't a hip arthritis problem, but it was a labral tear. Honestly, Scuba, I would treat it the same. The exact same. And here's why. It's the same imbalance that puts bad pressures in the hip joint, and it puts too much pressure in the front of the hip where the labrum usually gets torn. And so if you can get the glutes stronger and center the ball in the socket and get the pressures normalizing the ball and socket, then you allow that labrum on the front part of the socket of the hip to not get so much pressure, and it tends to heal. We tend to help people in that situation. So I would proceed through the same stuff, because it can be real bad to where you need to offload for a labral tear. You need to be doing some thigh fidgeting just to get some decent motion in there that isn't aggravating. You need to fix the mindset, because in the case of a labral tear, you'll get an MRI, not an X-ray, that will diagnose the MRI. The MRI will diagnose the labral tear. Then the doctors are thinking, well, are you too old to have a labral tear repair surgery? Can we manage it? They start thinking about it, because if you're, I think, over 50 years old, they won't even do the labral tear repair because the outcomes aren't great afterwards. But if you're younger than 50 years old, they might give it a shot. There's other factors. But then what the doctors don't think about is the muscle imbalance. That's what I'm telling you about here. So that means you might have to quit walking, go through glute activation, go through abdominal activation, relearn how to walk after you've gone through the activation of these two, figure out how to do squats in a way that focuses on using your glutes and abs, doesn't aggravate your hip, then relearn how to use stairs if stairs are a factor for you, and make it a habit. that will solve a hip labral tear problem for many, many people and help you avoid developing the arthritis problem that comes after the labral tear problem. Good question there, Scoober. Thank you for answering my question. Absolutely. You're very welcome.
We're done.
All right, guys. Thank you so much for joining me on this live today. We'll be here next week. I love you all. Thank you all for joining me. And please share this if you haven't already with a friend that you think needs to hear this. Please drop more questions. We're trying to get to the answers, to answering your comments as much as possible. Don't forget that we have phase 1 for the hip arthritis recovery program for free on our website. And please, if you haven't subscribed to our channel yet, I don't want you to miss any of this helpful information. So please hit that subscribe button, turn on the notification bell so you don't miss out on our lives, and have a chance to talk to me on the phone or drop questions in the comment section that I love to answer. Catch you guys next week. Bye-bye.